Hello, greetings from Foggy HQ. As you will know, I've been running the Shake It Up campaign since October 2021, or maybe the start of November. So that's virtually 2 years. And we, the community, chronically sick people, people that have been harmed by an array of non-pharmaceutical treatments, have been asking for a system to report harms from non-pharmaceutical treatments for around 2 years. And I keep being told, one, patients aren't harmed. Two, there's no need to collect that data now because NICE no longer recommends graded exercise therapy or CBT for people with ME/CFS. And it's just been one brick wall after the other. About a month ago, I got contacted by a foggy friend who said, have you ever heard of the NRLS? And I'm going to tell you what that means in 2 seconds. And I said, no, I haven't. And we had a bit of a conversation and I thought, hang on a minute, I need to know what the NRLS is. And that's what this video is about, because I've just received an email from Vicky Foxcroft and I'm having a bit of a bad ME afternoon, but I'm wondering, am I missing something? And I want to run something past you. Okay, 2 seconds. So the email you can see on your screen is the email that I received from Vicky Foxcroft, literally probably about half an hour ago. And as she says at the top, please see below the answers to the parliamentary written questions I submitted on the NRLS on your behalf. And then she goes on to say, she lists the questions that she asked and the answers. So the first question was to ask the Secretary of State for Health and Social Care how many patient safety incidents were reported before the introduction of the National Reporting and Learning System, NRLS, and what data he holds on the number of such incidents recorded in each of the 5 years before and after the introduction of the NRLS and in each of the last 5 years. Right? And it was also grouped with these questions to ask the Secretary of State for Health and Social Care what assessment he has made of the level of public awareness of the National Reporting and Learning System and whether he is taking steps to raise awareness of the system. And 2, to ask the Secretary of State for Health and Social Care how the National Reporting and Learning System works alongside independent reports to individual clinics, hospitals, patient advice and liaison services, and clinical commissioning groups which are dealt with in-house, right? Which is one of the reasons for the Shake It Up campaign, because all of our complaints of harms are dealt with internally. And we're told there isn't an issue and it's closed. The harms are not counted or collated anywhere centrally. How do we know that? Because NICE, in the NICE guideline review of ME/CFS in October 2021, said there were no reports of harms from CBT and GET. That I'd already been an advocate for at least 7 years at that point, and I knew a heck of a lot of people had been complaining. So I knew that something wasn't quite right. So, as did lots of other advocates and patients. But that's why I started Shake It Up, because it just didn't connect. There's a disconnect there somewhere. Anyway, so Maria Caulfield, MP, wrote back with this. The National Reporting and Learning System has been in operation since 2003, remember that date, and supports NHS England to fulfil statutory duties relating to the collation of and learning from patient safety incident reports. The NRLS is principally, this is what I don't understand, a secondary use service. Can someone tell me what that means? And collects patient safety incident reports that are recorded on healthcare providers' local risk management systems. The primary use of patient safety incident records is by the provider organisation that collects the data on its own, it's too much jargon, on its own LRMS and uses the information to support local safety improvement efforts. NRLS was created to support the national collation of patient safety incident records from LRMS, and some of the existing LRMS predate the introduction of the NRLS. So in other words, This patient safety reporting system has been in place since 2003, if not before that. So why, given that I've had numerous emails from Secretary of State for Health and Social Care, the Select Committee for Health and Social Care, NHS England, NICE, not one of those agencies has ever said that there is such a thing as the NRLS. Ever. So that's that. Do they not class harm from non-pharmaceutical treatments as a patient safety incident? I personally would class that as a patient safety incident. Anyway, goes on to say, given its age, NRLS is being replaced with the new Learn from Patient Safety Event Service. Oh, they do like these catchy titles, don't they? More information is available at the following link. So I've had a click through. I'll click through now. I've never seen this page before in my life. I've never been signposted to it by any of those agencies. And this must have been written in 2000. Oh no, this is the thing that's replacing the NRLS. So is a new national NHS service for the recording and analysis of patient safety events that occur in healthcare. But there is actually a bit here. Record a patient safety event. Organisation, staff and patients will be able to record the details of patient safety events, contributing to a national NHS-wide data source to support learning and improvement. This makes me so cross. I feel like I've wasted 2 years of my life. So it's a major upgrade, creating a single national NHS system for recording patient safety events. It introduces improved capabilities for the analysis of patient safety events occurring across healthcare and enables better use of the latest technology such as machine learning. Make it easier for staff to record. So I'm going to be having a word with the person that got me onto the NLRS. So I'm not going to say who they are because I don't want to cause an influx of emails and stuff for them. But I am confused, and I'm going to just pause for a second. So I'm confused. I'm going to go into that in a minute. But the next bit down says NLRS and its replacement, I hate these letters, LFPSE, support the collation of patient safety incident records from members of the public. I wasn't sure whether this was healthcare only, but members of the public can do this. NLRS does this through the patient and public e-form, which is available at the following links. So if I click through this link, this is where you go to report safety incidents, right? And it's supposedly collated centrally since 2003. And yet NICE had no reports of any harms. Could that be because the public don't know it exists? Could that be because healthcare thought, no, we haven't harmed them. It's just they didn't do it right. So yeah, so you would go to the general public and then fill in the e-form. So why have I been told that this is not possible? Because at what stage during your care did the incident occur? Treatment, discharge, ongoing or follow-up care. Please define here. Was the incident related to? Availability of staff, coordination of care, devices, equipment, infections, lack of communication. That could be one of the issues. Medication problem, patient notes and record. That could be because they don't believe that MECFS exists. Patient accident, self-harm. Staff failed to check the patient. Yes-ish. Staff members' ability. Yes-ish. So I'm like, what is going on? If this system existed, and it's not just me, somebody else tried to set up a petition because nobody else within our community had heard of this. So I'm like, I'm in two minds. Hang on, let me just pause again. Wait a second. Okay, I'm not going to read out these other two, apart from the one at the bottom says, no data is held on patient safety incident recording prior to the introduction of the NLRS in 2003. Well, I would only really be interested in from when grade exercise therapy and CBT was introduced to 2021. Because why was that information not available to NICE? And I genuinely think it's because the public are not aware that this exists. Maybe they don't consider non-pharmaceutical treatments as eligible for this system? I just don't know. I'd be happy to hear everybody's thoughts. But if I just have a quick look at data on the number of patient safety incidents collected by NRLS is available at the following link. I just want to know what happens to the data. We've paused the annual public, surprise, while they upgrade it. Data workbooks and commentary, official statistics, data. See, I throughout Shake It Up, I've been saying we need data. There is no data on harms. And this says data published before. So we publish annual official statistics on incidents reported to the NRLS. These official statistics were published every 6 months prior to the 29th of September 2021. Again, that would have been relevant for NICE. It describes national patterns and trends. Okay, so now you can see why my head is a little bit fried, because either there's a few things going on here. Either they do not see non-pharmaceutical treatments as so harms from non-pharmaceutical treatments as safety incidents, and I've been told it's too difficult, we wouldn't be able to set up a reporting harm system. Well, what you've just seen on your screen is exactly what I've been asking for. So, right, why have they not emailed me and said, funny you should say that, we're upgrading our NRLS to whatever they've called it now, lots of letters. Can we speak to you to make sure that there's inclusive language there for people that are harmed by non-pharmaceutical treatments? That's what I would do. If I was in charge of a massive corporation that's like a humongous machine that ignores people with chronic illnesses left, right and centre, I would think, hang on, there's somebody over here that wants a reporting system for harms from non-pharmaceutical treatments, and we're trying to update our patient safety incident reporting thing that patients can report themselves. Oh, I wonder if we could put the two together. Does that sound like something that could happen? So yes, I will be getting in touch with the relevant departments and saying, I've been campaigning for this for 2 years. I've been told it's too complicated and too expensive to implement. Why can't you just add another box, non-pharmaceutical treatment? Tick. What happened? Anyway, so there you go. So as I said, I'm going to contact the person that put me on to the NRLS. Oh, I'll get the letters around the wrong way. It begins with an N and ends with an S. And see where I go from here. Because, oh my goodness me, what a mess. I hope you all managed to keep up to date with where I was trying to go with that. It's been a bit of a neuro-exhausted day today, but that's just crackers. I am going to send that to NICE and say, is this not the kind of data that you would have benefited from? So you need to ask, why were healthcare staff not logging these incidents when they were reported to them? Anyway, I hope you're all right, and I'll catch you again soon.